I'm Hallie Koch, a congressional lobbyist with the American College of Surgeons in Washington, D.C.
I'm Matthew Brown, a congressional lobbyist with the American College of Surgeons in Washington, D.C.
Hi, I'm Emma Zimmerman, a congressional lobbyist with the American College of Surgeons staff in Washington, D.C. Every day, our team works with congressional offices here on Capitol Hill to advocate before lawmakers on behalf of surgeons and the patients you serve.
While it's important to interface directly with members of Congress when the opportunity arises, their staff are a key resource that drives the process in advancing your priorities through the legislative process. An office in the United States House of Representatives has between 8 to 12 staff, and an office in the U.S. Senate can have anywhere between 20 to 50 staff. If a lawmaker holds a committee or chamber leadership position, they'll have additional staff that work specifically in that committee or leadership office, in addition to the staff in their personal office. You can break down the staff in a congressional office into 3 key categories: administrative, communication, and legislative. Administrative staff include the chief of staff, the scheduler, staff assistants, and interns. The chief of staff oversee the office personnel and serve as the gatekeeper to the lawmaker. Many chiefs are employed by both the official legislative office and on the campaign trail, serving as a political advisor outside of the official duties in Congress. Another administrative position is a scheduler, which could also be referred to as an executive assistant or operations director. Schedulers process and respond to incoming meeting requests and work closely with the chief of staff to prioritize certain stakeholders that matter most to the lawmaker. Lastly, staff assistants are full-time staff that work in the front office alongside full-time or part-time interns. Staff assistants and interns answer the office phones, give constituent tours of the U.S. Capitol, and handle general constituent requests and administrative duties. Their goal is to make sure that every constituent that communicates with or visits the official office has a positive and meaningful experience.
Communications staff include those with the titles Communications Director, Press Secretary, Press Assistant, and Social Media Director. Communications staff are in charge of drafting and disseminating official press releases, dealing with the media, and managing social media accounts for the lawmaker. Legislative staff serve as experts and advisors to lawmakers on a specified portfolio of policy issues. Because there are only a handful of legislative staff in a House office, each staffer typically has a broad portfolio of 10 to 20 issues, such as healthcare policy. In a Senate office, legislative staff tend to have a more narrow scope of issues and are therefore more specialized in the knowledge of those policies. Legislative staffers are who you want to meet with to discuss your issues on Capitol Hill. Their job is to report back to the lawmaker on who you are, what you discussed, and what your ask is. Importantly, they will make a recommendation to the member of Congress on whether or not they should be supportive of your priorities.
There are a few titles you should be familiar with within the hierarchy of the legislative staff in a congressional office. The first is the legislative director. They are the chief policy advisor for a member of Congress and tend to be assigned the issue areas a member of Congress is most concerned with. Typically, these will overlap with any committees that the member of Congress is assigned to. Legislative assistants, or LAs, are the lead policy staffers on any number of legislative issues and report to the legislative director. Legislative correspondents, or LCs, work under the LD and LAs, assisting in policy research and drafting response to constituent correspondence. Members of Congress have well over 100 issues that they're concerned with. Staff are the people who ensure that the lawmakers have accurate information. Creating relationships and offering yourself as a resource to these key staffers will set you up for success advocating on behalf of your colleagues and patients. To learn more about how the American College of Surgeons participates in federal advocacy and how you can get involved, please visit facs.org/advocacy.